Welcome, and thank you for joining Chamberlain University's Mastermind Session. My name is Dr. Danica Bowen, and I'm the Senior Director of Higher Education and Global Partnerships. And it is my privilege to moderate today's topic on interdisciplinary professionalism. Our panelists will be discussing interdisciplinary professionalism in the healthcare field. Interdisciplinary professionalism, and you'll hear me say that a lot today, is of critical importance and a conversation that must continue as healthcare providers learn to work as a team, particularly in high-stress environments. Today, I am honored to have joining me a distinguished group of experts in interdisciplinary professionalism. I'd first like to introduce you to Dr. Katie Kay. She is the Senior Director of National Academic Operations at Chamberlain University and is responsible for providing leadership to university-wide operational and quality initiatives. Dr. Kay has over 15 years of experience in nursing profession, specializing in critical care, emergency medicine, healthcare system operations, nursing administration, and academic operations. Dr. Kay holds a doctorate of nursing practice degree after earning her bachelor's and master's of nursing science. We also have Dr. Stacy Baraski-Ferguson, who we will refer to as Dr. B throughout this presentation and conversation. Dr. B has over 30 years experience in social work practice and higher education. Her practice background includes child welfare and mental health, where she worked with teams of other professionals to provide high quality care and service to clients. She's also been in social work education since 1996, currently serving as the Dean of the Masters of Social Work program at Chamberlain. Prior to her appointment at Chamberlain, Dr. B was the Director of Accreditation at the Council on Social Work Education and a Program Director and faculty member at universities in Tennessee and Texas. Dr. B is the co-author of 2 books with Oxford University Press, lives in Texas with her husband and youngest child, and has 3 wonderful dogs. So let's go ahead and get started, everyone. And Dr. Kay, I'd like to start with you. How do you define interdisciplinary professionalism other than a tongue twister?
Sure, no problem. Thank you. And happy to be here today and talking about something that's so important. When we think of interdisciplinary professionalism, we first go back to collaboration, right? That's the previous term that we always use, the interdisciplinary collaboration and the way we work with the other members of the healthcare team. Where professionalism comes in is not only the fact that we're recognizing the fact that we have to work together to deliver high quality patient experiences, but it's the way that we work together. It's the way that we communicate with each other in a very succinct, professional, clear manner so that we're really driving forward with the plan of care for the patient or the member of community that we're working with in a way that's meaningful to them and in a way that recognizes all the expertise that the different players of the healthcare team bring into play. This is becoming increasingly more important as we're shifting the way that we're delivering healthcare, not only in response to the pandemic that we're currently in, but also in a way that we're really promoting more health and wellness now and not reacting to disease, but trying to work together to prevent disease and really optimize the health of our communities that we serve.
Very well said. And I think you touched on this, but can you elaborate further on why interdisciplinary professionalism is so important? What are the benefits?
Oh, sure. Really, the benefits are first and foremost that the patients that we serve are going to have a high quality outcome. If we're not interacting professionally with the team members, we're really putting our patients at risk that something untoward could happen to them during their stay with us in an inpatient setting, or that we're going to just completely miss the mark on what they might need from a health and wellness perspective. And that's certainly not what we want. And the other piece to this too is when we're working together professionally as a team, we're really speeding up the process of engaging our patients, getting that trust and buy-in with the plan of care, and allowing really a higher quality experience. So the patient is going to report higher satisfaction. That's going to increase reimbursement rates for our healthcare systems, but also then keep patients out of the inpatient care area, which is more expensive for healthcare delivery, longer, and lead them to live higher quality lives. So the benefits of communicating with our interdisciplinary team in a professional manner are really truly endless, and important to really keep responding and adapting to the needs of our patients and the community members that we serve, but also the needs of the healthcare systems and the healthcare partnerships that we have to ensure that we're stable and how we're answering the demands that we're currently facing in our healthcare climate today.
Good points. And actually, that leads me to the next question. And I'd like to direct this at both of you. In what ways have interdisciplinary communication improved? And what remains some opportunities for improvement?
Well, I think that in the old days of healthcare practice, we probably didn't spend as much time respecting one another and what each profession brought to the table. And I've seen such change, especially so in the last 10 to 15 years. I think we've done a much better job at talking to each other about what each of us knows about a patient. And that is the critical piece. I may be, as a social worker, the person who spends a lot of time talking to the family and is gathering information that maybe no one else has. And so it's important for me to communicate that. And I think, and it's important for me to listen to what the nurses or the physical therapist or the occupational therapist has learned and what they see happening, because ultimately we're all there to take care of that patient while they're with us and to send them home or back into the community with all the resources that they need and a plan of care for afterwards that they can actually do. One of the things that I used to see when I worked in a hospital was that oftentimes there would be things put in a plan of care that I knew they can't do that. They don't have a car. So they can't get to where you want them to go. So I've just seen such a difference in how healthcare is delivered in that regard. I think we're doing a much better job at communicating and making sure that we talk to all those people who ultimately are all responsible for what happens to that patient while they're with us and when they go. It's much better than it used to be.
I think you brought up a great point, Dr. P, regarding looking into the individual needs of the patient. I can recall a specific time when I was working in the ICU years ago where a discharge plan included a patient that was prescribed a medication only available at certain pharmacies, and that patient would have had to take 2 buses to get that medication filled rather frequently too, because it wasn't dispensed in large quantities. And that's just, as you said, it's just not realistic. So we're not setting up the patients for success if we're not talking to each other and all the key stakeholders that have all those important pieces of information. I do think we're certainly moving in the right direction with this because we've been talking about it for quite some time. Nursing switched to the SBAR model, which is a situation, background, assessment, and recommendation. And that's become a fairly common way that we communicate with other nurses and other medical professions in the healthcare system. But we've also seen organizations and healthcare systems adopt programs for all colleagues and how we're relating to each other and talking with each other. One that's taken off and has a lot of ground is the program Team Steps. So that's really focusing on the professionalism piece too of how we talk to each other. We all know healthcare can be a very high stress situational environment, and we need to manage our emotions and how we're communicating with one another so that we're not fueling the flames, so to speak, and causing more stress with the way that we communicate to the other members of the team, so that we're ensuring that we're really getting the message across of what's needed of the patient that we're working with or population that we're working with, and really move forward with the right plan of care.
Yeah, really good points, both of you. And Dr. B, I'd like to go back a little bit in the social work. So in healthcare settings, what roles do social workers play and how do they interact in the patient care with other professions? Can you elaborate on that a little bit for us?
I sure can. So I think a primary role that social workers used to play, and now I think they share that responsibility with nurses, is discharge planning. So it's one of those pieces that I used to do as a social worker in a medical setting in a hospital. I often was called in to assist with discharge planning when there were really complicated social issues that a person was facing. So if there were someone who was homeless, for example, or who had come into the hospital for alcoholism and cirrhosis and a flare-up of their cirrhosis because they're still drinking. And so they need some post-addiction care, and I needed to do an assessment on that. I've child abuse, domestic violence. So I remember being called to the physician's offices that were partnered with our hospital. They would say, can you come over and meet with this person? She's here for an OB/GYN appointment, but we're really worried about her. We think there's something happening at home. And so I think some of those social determinants of health pieces that we talk a lot more about in healthcare than we used to really have often been things that social workers sort of lived with, that those environmental factors, family system issues, those are the things that we are often asked to come and be part of that healthcare delivery system. So that's a big one. We also play an advocate role. So I remember doing that for a patient. I'll tell a quick story. My internship as an undergrad many, many years ago was at a veterans hospital. And I was on a medical unit, and I had a patient that had cirrhosis, and he hadn't been drinking for years, but he'd done so much damage that he had this very strict diet, and he didn't follow it. And the doctor at the time was really, really upset with him and felt that he wasn't following orders, and he was upset with the family, that the family wasn't taking care of him. And to make a very long story short, after a second hospitalization, the doctor wanting to commit him psychiatrically for not following his care, I discovered from talking to the patient that he said, you know, I'm going to die, and I know that. And I just want to live my last time on this earth doing and the things I want to do and living and eating what I want. And the ice cream man comes down my street a couple of times a week. And when my family's not home, I just walk out and buy myself ice cream. And I want to have ice cream before I die. And I remember going back and, saying, this is one of those areas about self-determination for a social worker that's so important that, yes, I hear you. We're not supposed to knowingly contribute to people's health, poor health, but he's going to do it. And so ultimately the doctor agreed and said, we're not going to lock him up. We're not going to do that to him. So I felt like that was an important role for me to play, was an advocate for patients. Definitely a person who helps communicate to the larger systems when people leave, and making sure that people have accurate that's the right word, the kinds of services, and Katie and I both mentioned accessible services. So not only the appropriate medical follow-up, but do I need to contact extended family to help with transportation? Do I need to set them up with some local transportation? Do I need to call domestic violence shelter and potentially take care of this person and get them set up? So there's a variety of things that we do that, and I think the roles that we play that facilitate better outcomes for people. At least I certainly hope that they do. So an advocate, an educator, discharge planner, just a whole bunch of those things. I used to call us the jack of all trades. Just throw something at me and I'll figure out how to do it. And I think that's what we do.
That's such a great way of illustrating your point. And I will admit, when you brought up the idea of the ice cream truck, I had the sounds going through my head. I think that would get me running. the truck. That's not probably speaking of myself too favorably, but yeah, that would get me jogging. Yeah. This is such an important topic, and one that it's just critical that we're having these conversations. Dr. Kay, how does Chamberlain University address this topic? How do we embed it? How do we get conversations going?
We do have this really embedded in our curriculum right now in the way that we talk about it with our students in our discussion threads. But what I'm most excited about with Chamberlain University is how we're going to partner with Stacy's program or Dr. B's program with social work and nursing, and looking at opportunities that we can really create interdisciplinary environments for the students to allow them to communicate effectively with each other and practice that professional dialogue. We all come from different backgrounds. We work with different patient populations, and the way that we interact might be different, especially because we are a university that reaches students all over the country. And really just having that time to practice the way that we communicate and then reflect on that and what worked and what didn't work, or what opportunities we have for improvement, I think is going to be key as we continue to move this conversation forward on the importance of interprofessional relationships and communication. So I'm really excited about where we can go. I'm most excited about looking at how we can partner with our nurse practitioner tracks and looking at how they might interact with social workers, or even having the social work program partner with us in pre-licensure and offer some additional support services and learn together in that type of setting. I think that that's so important.
Such a great point. Oh, sorry, Dr. B, go ahead.
Well, I would love to comment on that if you don't mind. It was one of the things that attracted me to Chamberlain to come to work here was the idea that we had public health and we had social work coming, and nursing had been here for a long time, and our partnerships with other institutions that are part of Adtalem. It was just exciting to me to think we could really do interprofessional education and interdisciplinary communication and collaboration the right way. IP isn't meant to be just a class here and there that someone teaches you about the other professions. That's certainly part of it, but it really is meant to be a program that's deliberate and planned and puts students together across disciplines in situations just like it would look like in practice. And they learn to work together as part of that team. So it's modeling for them what we know they're going to have when they leave. And that was a really important factor in my coming to work here. And I'm really excited that we are on that pathway in a really serious way. I'm very excited about being part of it.
Well, let's expand on that because sorry, go ahead, Dr. Kay.
Yeah, no, I just wanted to elaborate too on what Dr. B said. She's absolutely right. It's not just one class that we would put in a curriculum. It's really just the way that we have to do things. And the only way you're going to get good at it and be good at doing it consistently, both in the educational and professional setting, is to have that just embedded throughout all that we're doing and really promote that. And I think, the one other thing I would take away from this is we have a really good working relationship with each other. So the leaders, the faculty, we all communicate in the same type of way, in the same professional manner, and then we model that also for our students. So I think that that's also something that's important, is that you're not just putting it in a course or putting it into your content, but really practicing what's important and then modeling it to others as well.
Such a valuable point. So let's take this outside of the healthcare setting, maybe schools. Healthcare services are offered as ancillary services. What do interprofessional teams in those settings do? How do they work with non-healthcare providers to support those that they serve?
Right. Now, this is a great question because it goes back to the way that we're really trying to transform healthcare to be more meaningful to those that we serve. School-based health initiatives are really taking off and doing great things in promoting health in really high-risk school area districts, more of our urban settings, where we're seeing nurse practitioners that are going into the schools, working there a full clinic day. They get approval from their the parents, obviously, to see the patients in the clinic, but they can manage those chronic conditions or maybe day-to-day illnesses that they may incur without the parent having them to pull them from school and take them to a doctor's appointment. So this is really huge for things like diabetes management, asthma management, and really promoting that the child is still going to school, so absenteeism is an issue that's we found in the research really important for student success long term. But then again, also the logistical piece of it being right there shows greater compliance rates, not only for chronic condition management, but also for things like vaccinations and health and wellness checkups. So, knowing this and knowing that we're now removing healthcare really from the primary care setting offices that we were traditionally seeing and taking it really to the population we serve, this opens it up. So we're not only communicating now with other healthcare professionals, like the social workers, we're communicating with healthcare educators, parents, community members, to really ensure that we're meeting the needs of the community that we serve. I think we're going to continue to see these types of trends, even now with maybe looking at businesses or larger organizations that might capitalize on this type of approach for health and wellness. We've seen lots of employee wellness initiatives take off over the past 5 to 10 years. I'll see those likely continue moving forward, but also again too with virtual options, with the way that we're connecting with individuals with telehealth and telemedicine, also expanding into that space. We're going to have to work very collaboratively with what we need from a platform perspective with IT institutions as well. So really the way we collaborate with others is not just limited to healthcare professionals at all. It's a very expansive space, and really everyone could be a key stakeholder in that.
I think too that what's interesting to me, Dr. K, I just had to jump on that bandwagon with you, because I think back to schools. You know, most of my kids are grown now. One's still in school. But I remember when my oldest was really young, talking to teachers about all the things that they were learning about kids that were happening at home. And they would come to me sometimes and say, what should I do? You're the social worker. What do I do with this that's happening with my kid in my class? And I think we have such an opportunity to affect the educational outcomes for kids. And so when we're part of an educational system, I used to say that schools are really like one-stop shopping, or they could be. And wouldn't it be great, since they have to be there 7 and 8 hours a day, if we could flood them with the things that they have struggles getting to, like healthcare and dental appointments and vaccinations and, you know, and just classes or counseling, whatever they feel like would be beneficial to their, and frankly, to their families, because their parents will come. If there are things that the school also offers that help their family, we might see greater parent engagement. So I think that's one of my most exciting things about being part of these other systems and providing what we offer in non-traditional healthcare settings, is we have a chance to really impact the quality of the educational experience for kids too, and hopefully improve their outcomes that you mentioned, Dr. K.
So interesting. So Dr. B, what advice would you give to a new social worker beginning practice, where we know interprofessional teamwork is so critical?
I think there's really two things that stick out for me the most. One is to, on a personal level, to know your value and know what social workers bring to the table, because you have to be an active member of that team. You can't just sit back. And I felt this way when I first started out. I was young, like all these people know more than me. No, you know what to do as a social worker, and your job is to represent that in any team that you're a part of. And the second thing is to be very respectful and listen to what everyone else brings to the table, and listen to what the knowledge they have and their expertise, and let it inform the way that you interact with your clients. Those are the two big things. Know your value, be part of that team, assert yourself as part of that team, but at the same time, you absolutely have to respect what everyone else brings and learn from them. Take what you can get from them, and it'll make you a better social worker.
Dr. K, what are your thoughts? What advice would you give to a new nurse beginning practice?
I think listening is probably the most important piece of communication. The more we listen, the more we learn, not only from other healthcare providers and professionals, but from our patients. So the story that Dr. B brought up earlier about the ice cream was so touching to me, because it's amazing what we learn about our patients and those that we're working with by just simply taking the time to listen. So I think that's the one first piece of advice I would give. And then the second would be never stop learning new ways or different strategies to communicate more effectively. And I think a great way to do this is through really just self-reflection and practice. So there's always opportunities to improve the way we communicate within whatever environment we're in, whether we're challenging ourselves to work with a different population or communicate in a different way. I think that's just so important as well.
Well, let's talk a little bit about the world today. What is the impact of COVID-19 on interdisciplinary professionalism? And let's start with Dr. K. And we'll go to both of you.
Sure. So the impact is going to be significant, and not just in the way that we're treating our COVID-19 patients. Obviously, that's a challenge. We have hospitals that taxed in a different way. A lot of our patients that we're seeing now have been not going to see their primary care provider or specialist because of being on lockdown, being more reserved. Perhaps they were doing, maybe some telehealth visits, telemedicine visits, and just not getting the same level of care that they were pre-pandemic. So what we're seeing in the Midwest right now is a trending up of those chronic conditions, exacerbations of those, more hospitalizations than we would previously see with some of our, comparing to previous years at this time. So that influx of patients is certainly a challenge when you're also getting an increase in patient volume related to the COVID-19 crisis. So really just maximizing the way that we're using our hospitals, who's getting admitted, who we think is okay to be transferred out or discharged home. And that really has to do with how we're working with the healthcare team and what needs they have to really set them up for long-term success. So the stakes are higher, I think, when we're looking at healthcare system throughput and how we're managing our capacity. And then the other thing that I want to bring up about the pandemic too is inconsistent. We talked a lot about school-based health and really the importance of children getting the right care that they need at the right time. And I'm worried, and I've seen a little bit in the literature currently, or in the headlines, I should say, that we're not at the vaccination rates that we should be. We're behind on those health and wellness screens. So I worry too about that population, and that we're going to miss the boat on some key diagnoses that really could impact that population if we don't really work together and figure out a good solution on how we can really provide robust services to our patients and communities that we serve during this challenging time. The effects are going to continue long after even the numbers for COVID-19 start to drop off. We're still going to face a lot of these challenges, and we're going to need to work very closely together for meaningful solutions.
Thank you. Dr. B, what are your thoughts?
Well, I concur with everything Dr. K just said. I also have been really honestly worried about the mental health of everybody involved in providing direct care. I have ER experience. I know Dr. K has ER experience. Those situations are stressful enough. And now you're having to make decisions in some places to triage people, sort of like a MASH unit, and some of those really where the cases were very high and who's going to make it and who's not. That kind of trauma worries me for everybody that's involved in the system. So I'm concerned about the mental health and of their families, and that they're getting the care that they need. And I think from an interdisciplinary standpoint, we've got to recognize what our colleagues are going through, and we have to take care of them and make sure we're supporting one another. The other thing that I am worried about, and I hope the leaders are thinking about these things, are the impacts on larger systems that have this ripple effect across our country. So right now, everyone's thinking about, do our kids go back to school? So we have, I'm very fortunate that I can work from home and manage my job, but a lot of people are really struggling already right now, trying to homeschool kids and take care of their jobs and manage all of that. And there's going to be a point where the rubber hits the road, where if the schools don't open, what does that mean for employment? What does that mean for people's jobs? What does that mean for women specifically? Because we are often still the primary caregivers. So what will be the consequences on women in the workforce? So there's a lot of really big questions that I think we are not really wrestling with as much as we are going to need to, just because we're just trying to stay afloat right now and take care of people who are sick. And so that's one of the concerns that my husband would tell you. I talk about this all the time, but I'm genuinely worried about the impact on women in the workforce, and what will happen if they can't go back. I have teacher friends who are talking about retiring because they're afraid to go back. They've been at it long enough, they can retire now. Makes me old to say that, I know. And then I've also seen people making out their wills because they're scared of, even if they don't get sick, then if they get sick and they pass away, or what if they take it home to an elderly person? And I forget the percentage, but it's a significant percentage of families in this country who have an elderly grandparent or an elderly relative in their home. So it's not just, hey, if the kids go back, to school, they won't get as sick. We don't even know all of that yet, I don't think. But even if it's true, they bring it home. So I think we just have a long road to go here right now. And we have to take care of each other as professionals. We have to recognize that just because I'm at work doesn't mean that something at home isn't also happening to me. And we do a good job of that with each other at Chamberlain. I'm really proud of that. I'm proud of Chamberlain Care and how it really does. It's infused in the way we take care of each other and take care of our students. And I just hope that that can spread across the country. We need it right now.
Well, this is an absolutely wonderful discussion, and I just checked the clock and we're starting to run down. So let me leave with this final question. What are your final thoughts, and what would you like to share on the topic of interdisciplinary professionalism? And let's start with Dr. K.
Sure. I think we just need to continue to keep this conversation moving forward and really just highlight Dr. B's point is that now more than ever, we need to be caring towards each other when we're working with colleagues and community members. Everybody is trying to make the best decision that they can with the information that they have, and that's changing very quickly. The dynamics of what's happening in the world today are moving fast. So allowing and extending grace to each other as we're working in a high stress environment, I think is really, really key. And I would just like to leave on that note that, extend grace where you can, listen when you can, and really just care about one another.
Dr. B, take us home.
Well, it's hard to top that, so I'm not going to try. I'm going to echo exactly what Dr. K said. I hope that if there's any message that we leave people with through our conversation today is that we're all in this together and that we all want the same thing, which is the health and well-being of everybody we encounter through our practice and in our personal lives. And I wish everybody out there kindness and patience and grace. I love that word, and grace towards one another. And thank you for having me be part of this today.
Well, ladies, I'd like to express my gratitude for spending this time with both of you, and then thank everyone for joining. Please don't forget to join us next week for the Mastermind Session where we talk about the brilliance of diversity in the workplace. So with that, thank you, stay healthy, and please stay safe.